The neutral zone is defined by Punjabi as a measure of spine laxity in the vicinity of the neutral position. An abnormal increase in the size of that neutral zone actually leads to pain by producing strain on the surrounding supportive passive tissues, like the disc, like the ligaments and the facets. Muscular factors are the essential components of maintaining the neutral zone within normal limits. Remember what I said, if you get too far outside that, away from the center, you're getting close to areas that you're going to create harmful forces at the end of range. The multifidus is the most important muscular factor in increasing stability of the motion segment, providing greater than 2/3 of the stiffness increase in the L4-L5 segment and preventing shear forces and abnormal movements that again would lead to trauma to the disc, the facets, and degenerative changes over time. When we continue in looking at motor control and normal organization of the body, this proper axial elongation and core control give us the greatest strategic potential for successful movement. When we have axial elongation, which is defined or providing this optimal environment for segmental movement of the spine, it decreases the compressive and shear forces that are thought to cause spine pathology. So the very essence of that principle in all of our teaching is going to minimize the risk of back injury and optimize healing and performance of the spine. Now, core control is often misunderstood these days. Core control, people think, is the same thing as having strong abdominal wall. Control is not equivalent to strength. What control is that you have the appropriate strength for the desired movement process. So if I'm a Cirque du Soleil performer, I might have my spine moving in all different positions and have a tremendous amount of stiffness at certain points of time in certain segments to be able to be safe through that movement. This inner unit or muscles engage, according to Diane Lee, to be able to create the appropriate amount of stiffness, not an excessive amount. If I recruit too many muscles or think I have to recruit this powerhouse every time that I move, I'm going to get in my own way. I want to do a little example with you here at this time regarding axial length. If you could imagine that the disc in between each of the vertebrae is like a little balloon, and touch the crown of your head as the central axis, and imagine that I had a little pump that could pump up those little discs and those little balloons. So we pump them up. Shh, 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 shh. Are you doing it with me? Good. Now, right there, let the finger come down and just rotate your body around that central axis and notice how good that feels, right? Now, think of drawing the abdominal walls in, lifting your pelvic floor up, and really recruiting that transverse abdominis muscle, and now rotate your spine and see how limited it is. That would be the perfect example of over-recruitment. Yes, those are the right muscles, but no, it's not the right tone, nor is it the right sequence, nor is it the right timing for that to happen to be healthy and to move efficiently. So when we talk about core control, we talk about what I learned from one of my great mentors, Alan Lee, as much as necessary, as little as possible. This goes back to what Joe was talking about of efficiency of movement, that we perform our daily tasks spontaneously and that we can do them with vigor and zest and pleasure, that we're not thinking about, oh, is my powerhouse drawn in while I'm bending down to pick up my child? No, it's just something naturally that we anticipate correctly because we understand axial elongation. The other thing that I want to just mention here is that the muscular slings engaged appropriately, right, and are dictated by the movement, not by us telling them to contract. When our body moves, the fascia feels the strain, and it communicates to the body of what muscles need to prepare in anticipation of that movement. So again, the consciousness should be around axial length and feeling that nice spatial awareness, not about a muscle contraction of the core to do that. When we talk about the multifidi and its normal organization, it plays a very powerful role in the proprioception of our spine. The lumbar tissues provide important proprioceptive feedback, and according to Lance Toomey, the multifidus contains 6 times, as I mentioned earlier, the normal number of muscle spindle fibers in the rest of the muscles of the spine. The muscle spindle fiber actually is a contractile fiber inside of the muscle, but it has a sensory component to it that goes back to the central nervous system in the spine and can communicate how much load is coming through that muscle. And that communication through our anticipation and that feedback mechanism from the muscle spindle fiber is what allows us to gradually refine it. So again, if our thought is as much as necessary, a little as possible, we continue to create efficiency through this feedback mechanism rather than creating something that gets in the way and interferes with normal, healthy movement. The transverse abdominis in its normal organization is thought to increase the intra-abdominal pressure appropriate for the anticipated load. In healthy subjects, there was a study done by Paul Hodges that looked at how the transverse abdominis and the other abdominal muscles responded in anticipation of movement of the arm in a flexion, abduction, and extension moment arm. And he found a very interesting phenomena. One of the things he showed was that the transverse abdominis fired 50 milliseconds prior to the firing of the deltoid of the arm. And it consistently did that in the healthy subjects. And what that tells us is that 50 milliseconds is subconscious. So even for us to interpret that research and say, let's do volitional or isolated contraction of the transverse abdominis, is outside of what the normal function of the transverse abdominis is. So let me repeat that. A normal volitional contraction, the fastest one, is going to be somewhere around 250 to 500 milliseconds. The transverse abdominis fires 50 milliseconds prior to the contraction of the movement muscle, or the global muscle. That is 5 to 6 times faster than a volitional contraction. The other thing Hodges discovered was that it was sub-threshold, meaning that it was probably in the 30% range of its maximum voluntary contraction. What that means is that it's not really going to be felt necessarily. We're going to have a sensory of being prepared for a movement, but we're not going to feel that volitional maximal contraction of a muscle if I told you to draw your belly in. The perfect example was that little experiment we did of pumping up the disc and how free you felt when you had the image of pumping up the disc. That definitely recruited the TA appropriately. When we went with the volitional contraction of the abdominal muscles, the TA and the pelvic floor, you felt a restriction because that became a maximal recruitment. And in reality, our body works with sub-threshold or sub-maximal. The pelvic floor muscles also respond to this idea of intra-abdominal pressure, and they work harmoniously with the transverse abdominis. Many times when I'm using the ultrasound to be able to image the transverse abdominis, I could use a pelvic floor cue and get the transverse abdominis to contract. Or I could be looking at the pelvic floor and give a transverse abdominis cue and see the pelvic floor contract. The reason is because of their relationship to the diaphragm in maintaining intra-abdominal pressure constant. In that hydraulic amplifier, when that diaphragm contracts and descends and increases intra-abdominal pressure, the transverse abdominis and the pelvic floor muscles are going to eccentrically contract to decrease that intra-abdominal pressure to keep it constant. When we exhale and the diaphragm relaxes and goes back up, the intra-abdominal pressure starts to decrease, and the TA and the pelvic floor work together harmoniously, synergistically, to increase that intra-abdominal pressure again and restore it to what is appropriate for that anticipated load. So we know in healthy subjects, the pelvic floor muscles are synergistic with the transverse abdominis. Now there's times when people have pelvic floor dysfunctions that we can actually teach them to differentiate between the two contractions. But what it really comes down to is understanding not only the pelvic floor and TA, but getting the diaphragm, even our vocal cords and thoracic mobility tied together to be able to have that efficient use of that hydraulic amplifier. When we look at faulty organization as it pertains to motor control of the spine, this is a hot topic these days because we spend in the United States alone over $300 billion a year in spine care. What we realize is that part of the faulty organization is this inappropriate stiffness for the anticipated load. Somehow we unlearn what we learned as a child, or through an injury we unlearn, and we either over-recruit muscles or we under-recruit muscles. So let me explain what the body does or seems to do naturally when there's an injury. When we incur an injury to an inert structure, like the disc, the capsule, the ligament, the muscle itself, or the bone, we experience a neurological inhibition that is secondary to pain. Pain inhibition often will cause a local inhibition of the local stabilizers. Those deep muscles, the multifidi, the medial fibers, even the transverse abdominis often will be turned off or turned down in their normal function, which creates a larger neutral zone that Panjabi talked about that puts you at a higher risk. So you have this instability now. You don't have control of the movement. So even simple things like a sneeze or bending down to tie your shoes or putting your pants on or bending over a washing machine put you at risk of re-injuring those inert structures. To prevent that, the body then sends a signal, or the mind, to recruit the global stabilizers. The global stabilizers are like the quadratus or the rectus spinae or the psoas major or the piriformis. And these muscles then go into a spasm. And because they're not endurance muscles, they fatigue very quickly and they become very painful in their own right. And so often what I notice as a physical therapist is that their pain is more associated to the compensation pattern than it is to the original injury to the ligament or to the disc. So one of my jobs as a physical therapist and you as a Pilates teacher is how do we wake up the local stabilizers to be able to tighten up that neutral zone a little bit and inhibit those global stabilizers that are trying to substitute the locals in their absence of the pain inhibition. How do we do that? Well, the beauty of Pilates is that segmental movement in a controlled environment, a safe range of motion, starts to wake up those local stabilizers. And it also inhibits the global stabilizers, right? Those global muscles, those big muscles that are in spasm. And so what we'll notice with simple things like a bridging or a pelvic clock or pelvic tilts, that little subtle movement starts to wake those local stabilizers back up and almost immediately increases the feeling of well-being. So we'll see people within 2 or 3 sessions after a back injury, a mechanical back injury, already feeling better. And they notice the balance between the stiffness and the mobility. The last part of this idea of faulty organization and the motor control aspect of the spine and axial length is this balance between excessive stiffness versus excessive movement. And this is something that we learn over time, and everybody's a little bit different. But if we drew a bell curve and we looked at what everybody's stiffness or mobility is, it's going to be a little different, but it'll fall within the normal range. And so sometimes people will come and say, oh, I'm so stiff, or others will say, I'm so loose. We just want to work closer towards that balance between stiffness and movement. And that is stability, right? Stability is the balance and the control of movement. And that helps us to get in a place where we're less likely to go to an end of range where injury can occur, and we're more likely to be able to resist forces that would pass through those joints or those tissues without harming them.